Hi and welcome to this fourth in our series of interviews with health practitioners in the performing arts. My name's Dr. Mark Seaton and I'm delighted to have with me today Dr. Shona Erskine, who is a psychologist. Welcome, Shona.
Thank you, Mark. Pleasure to be here.
Shona, my first question to you would be, what first sparked your interest in performing arts medicine?
Right, so I had finished my study in psychology. So I'd done my undergrad, my honours, my master's and my PhD. And I had done more organisational and creativity focus in my study. And I had finished all of it and I'd had 2 children and I returned to teach dance in the studio. And it was in that moment when I went to redo what I had always done in the past that my mind was saying to me, no, you can't do that anymore. You know that doesn't work. There's a whole lot of other things going on here. There's a whole lot of other things you need to pay attention to. There's a world of knowledge now in this area. To just repeat what you knew before will go against very much what you now know. So it was a really interesting moment standing there teaching in the studio. I went, right, I have to rethink this whole thing now. So it wasn't until actually that moment after I'd finished studying that I became very curious about how the practicality of the way that we teach and work in the arts and how that relates to, for me then, to the practice of psychology.
What was it that then took you more closely to wanting to help professional artists with their health and well-being? What were the things that drew your attention particularly to taking action in that area?
It's a really good question because in some ways I have to say that it was because there was so much going on for young people. So at that time I was back teaching at vocational level dance in tertiary institutions. There was so much going on for them and staff would basically say, go see Shona. So they knew that I had the qualification and they didn't know in what capacity I was working, but they just knew that there were certain issues that were coming up for them that were beyond their capacity, or issues that would come up, they'd feel like they'd resolved, but then they'd come up for the student again a month later and again 6 weeks later and again. So there's this kind of rolling cycle of almost they had done what they could and so had the student to be able to alleviate some kind of concern, but it was just coming back constantly. So a part of it for me was that people started to come and see me and people started to ask me, and that really began to kick off my interest in it. I'm now in a place where I see primarily artists, performing artists and visual artists of all forms, and that has certainly grown through a very deliberate interest on my behalf to gain an expertise in that area. But initially it very much was just responding to the need that was around me.
So what particular needs, I guess, were highlighted? What particular ailments did you find yourself needing to treat or support them? Were there any ones that were particularly challenging to address as people were directed to you from classes or as professionals came to you to seek help?
Yeah, there's all sorts of things. It's so individual, the world of psychology. Look, on the whole, performance anxiety has to be a number one in many ways. The performing is, or exhibiting, so the moment where you present your work to the public, even if you're not the performer as a visual artist, is completely nerve-wracking, and there's not much scaffolding that gets done around that in education in the way that we teach our young artists. So we expect in many ways that they're going to be able quite naturally to step onto stage to do what they need to do. And unfortunately in some ways they are, because if they're not, they're culled out a long time before they get to professional training. So certainly performance anxiety is a big one, but connected to that confidence issues around being able to set goals and achieve things for themselves. There's also a whole lot of wouldn't necessarily say depression, but that is there, but also low affect. So when people are not achieving in the way they want to achieve, or they're not receiving from the practice of what they do, those lovely feelings that were the reason that they possibly did this thing in the first place, when those disappear for any kind of reason, I also see people. And I have to say, with performers, they start so young that there's then also those transition moments for them where they're becoming young adults, and it doesn't work for them anymore how they were treated when they were 15, but they're still being treated that way because that's how we treat artists. So they're wanting more autonomy or more freedom or more time to explore the world, but they don't have it because they're in the studio all day rehearsing. And I have to say that the most difficult things to look at are in many ways anything to do with eating and your self-care. So disordered eating, certainly, I see dancers. So disordered eating is one that can be challenging to change, but also anything to do with artists wanting to do better self-care, which is sleep, exercise and food. We all know the rhetoric around those things, but actually changing our behaviour is challenging.
For many student performers, even just acknowledging some of those as an issue and not to be ashamed to approach you must be important and significant for them to actually make the leap from thinking it's my problem and I'm the only one who has it to maybe there's a way forward. Are there particular significant health issues? I guess you've mentioned some already around questions of anxiety, questions of diet and sleep. Are there also things associated with the actual their effectiveness in performance or criticism they might encounter from others of either their rehearsal process or their actual performances?
Yeah, look, I think there's lots of ways that I could answer that question, because obviously we have seen reports recently that speak to levels of anxiety, depression, substance abuse and suicide ideation across the entertainment industry. So I know that there's all of that conversation going on. So I'm going to deliberately choose to answer the question in a different way. What I see as one of the main issues for the performers that I work with is that there isn't yet a system approach to their health as performers. And what I mean by that is not just their individual health on a purely human level, but on the level of them wanting to be elite performers. So when I work with a performer, and I'll test this assumption, but we will most likely be working with the assumption that they want to be completely amazing at what they do. So as a result of that, they're prepared to put themselves under a level of duress in order to get there, a level of duress that they're not going to put themselves under for other things in their lives, or people who are not performers may not put themselves under. And this can put them in a really challenging position, especially if there's not that support from their team. And this idea that you have a number of individuals in your life that you call on, whether it's the psychologist, the physical practitioner of some form, your chiro, osteo, whatever you like, the psychologist, your coach, your fellow ensemble members, like how that whole system works together to increase the likelihood you're going to perform at a really high level. And so I see a lot of issues where individual performers are trying to achieve in a way that, in fact, really they need a whole system around them to do that. So they're struggling because their coach or teacher is working with them in a particular way, but they're wanting to work in another way to achieve that thing. Or they're doing it alone, which is often how young artists are. They haven't quite cottoned on yet to the fact that if you want to be great, you're going to need a team.
That seems to be a very crucial new thing that we need to be offering, communicating to the community, to the arts community, that you don't need to, in fact, you shouldn't be trying to go it alone, that you should be finding a network of support, as you say, a team that with which you can get encouragement, get constructive feedback, a whole lot of things, I suspect, there. Are there situations where artists, you feel you wish they'd come to you sooner rather than later? And that might also feed into the question of where coming to you as part of a team of professionals that they're getting advice and supportive care from.
Yes, certainly. And I must say at the moment it's quite a nice mix on that front. But I do see artists who will show up a week before the show, or a week before they're traveling, or a week before something, and they've reached a point really where they're under extraordinary discomfort and strain. Maybe they're very anxious about it. Maybe they're talking about a lack of confidence. Maybe they've decided this isn't the right thing for them to do, but they've committed, so they have to go ahead and do it. Maybe they just feel like they're overstressed and they're too busy. But anyway, it's reached this critical point. But there's only so much that we can do in a week, especially once you're in it, especially once it is escalating for you and you're about to go and do your technical rehearsal or your dress rehearsal. One of the things I talk about is that I'm not saying we can't do anything in that week, but that to learn a skill, embed a skill, practice a skill in your rehearsals or in your class so that you've got it and you know you've got it, and then you can use it when you're in a project. It's so much harder to actually gain a skill in that critical final week before you go on stage. So I think, yes, it's not only about coming earlier or knowing from the last time you did it that you were really nervous, so I better catch that show I've got in 3 months. But it's also the time after you do your performing, and it's the reflection there as well, which we don't tend to do well in the arts either. We tend to just disappear or go on to the next contract. And so that learning time as well is really important. And again, psychologists can work in that too.
So really that's something what some might call the cool down or the aftermath of performance. That's the kind of aspect of performance process that you feel is often neglected in this area?
Yeah, we just churn. The performers are constantly churning through, and I've been talking more and more not just to performers but also to people who work in a supportive role in the arts, so producers or arts admin, and you know, they talk about that too. And I think it's one of the things that arise when people are project based. So if you don't work, you don't get paid. So there's no pay for the week after the show for you to do your cool down. You do your show, you move on to the next contract, and they're often overlapping as well. So there's this very congested, tight kind of feel, and in education too, right down through to the schools that teach young people with these assessment criteria. They just roll and roll and roll and roll. So a bit of reflective space in there as well would be a fine thing. So
as a second last question for our time together, what would you see as some of the traps or pitfalls that performing artists kind of find themselves moving into or slipping into that you'd want to sort of see if there was more education to kind of hopefully have them avoid some of those traps or pitfalls?
Oh, I liked this question, and I liked it because I'm about to talk in this way. It's a positive and a negative. So, for example, if I just look at dance, if I look at, say, ballet, the ideal of ballet and the virtues of ballet are essentially unattainable for most of us. There's a few bodies that have just got the right genetic composition and happen to be in the right place at the right time for the training that may potentially reach close to that ideal. The ideal is aspirational, and the ideal allows young dancers to focus themselves in a way that other 14, 15, 16-year-olds are not. You know, so there's a moment when someone must be connected to that idea enough that they're not going down to hang out at the mall. They're going to their dance class and they're dedicating themselves to that idea of perfectionism. Now, the flip side of that is because it's unattainable and because it can be so stressful to try to attain it, then all these issues can arise. So the virtues of all the forms, the classical musician, the classical dancer, the contemporary dancer, the visual artist, the pursuit of the ideal gives them the drive and the focus and the forwardness, but it can also undo them as well, because then they're not living a full life, or they're reaching for something that's impossible, or they've lost their own personal identity within the virtues of the form. And that's where, in that gap, we can see a whole lot of things arrive, I think.
So, Shona, the last thing I guess I'd like to ask you is, how would performing artists, what are some tips that you might offer performing artists to help them in their self-care, and perhaps also to identify when they might need to be seeing you as a professional provider of support, a psychologist? What would be some of the tips you'd be offering for performing artists?
So the first thing that I would say to performers is, you're a human being and relationships are absolutely hugely important to you. They not only keep you healthier in all kinds of ways, but they also protect you from your ailments and feeling low and being anxious. So definitely cultivate relationships both in the personal and in the public domain, or your professional domain. That's really important. The other thing that I would say is, keep your skills up and be aware that of the skills you already have. I think performers sometimes don't see what they've got as skills. They just see them as talent or necessities, and so they're not sure how to build on them. But if you keep building your skills, it gives you such a great platform to be able to stand on and say, I know this, I can do this, I've done this before, as opposed to feeling lost in it. Acquiring skills is also a great way to connect with other people and keep your professional development up too, which is great. And finally, like I said before, have a team. Don't try to go it alone. If your body aches, you go and see someone for that. If you're needing to look after your physique because you need to be of a certain weight or a certain strength, you might work with a nutritionist. And likewise, if you're to come see a psychologist, if you're noticing that a way that you are feeling is stopping you from being present in your work, achieving what you want to, stepping forward, anytime you notice that your inside space is stopping you from performing in a way you want to, then that's definitely a time to go and have a word with someone.
Great. Well, thanks, Shona, for your time on this.
You're most welcome. Thank you, Mark.
Yeah.
Thank you.
Yeah, thank you. And thanks to all of you for joining us for this session. This program is part of a longer series of interviews with health practitioners supporting people working in the performing arts. It's created by ASPAH, the Australian Society for Performing Arts Healthcare. I'm sure you'll be able to find a link to look at the work of ASPAH and perhaps join ASPAH in association with this video. This video is also produced with the support of Sense Connection. I'm Dr. Mark Seaton. See you again in the future. Bye.